time when we discuss and debate the issue of organ donor awareness and the issue of organ donation, that he wasn't able to come in and take this matter, but neither was the Minister for Transport able to come in and take this matter, but this is only a matter of life and death for some people. And it seems that the issue that I raised last year on this exact same topic has not been advanced by either the Minister for Transport or the Minister for Health. And I'd like to thank Mark Murphy from the Irish Kidney Association for coming in today to be here to listen to the response from the Department of Health, if not the Minister. On the 13th of March this year, I asked for the Minister for Transport to come in here to find out why he hasn't signed the statutory instrument that would allow the HSE access to the driving licence registry, where people have indicated on their driving licence that they would like to be organ donors. And he cited on that occasion two reasons. One was the issue of data protection under EU law. That was the response. And Brexit was another reason why organ donor information could not be shared. He was too busy with Brexit. What he said, but what we had supplied to him in May 2018, that according to research done by the Oireachtas Library and Research Service, he is able to share that data. The schedule can be amended in the legislation that would allow the Minister for Transport and Sports under Section 63 of the Finance Act to make regulations to make the database available. What he wasn't aware when he told us that because of data protection and EU law that he wasn't able to share that information is that the previous Minister, Minister Paschal Donohoe, had shared the data on the driving licence registry with everybody from car manufacturers to the Health and Safety Authority, the Motor Insurance Bureau of Ireland, to eFlow, a private company, Road Safety Authority, National Transport Authority, National Consumer Agency and local authorities had all received that information on the driving licence registry. People approved by the Department of Sport, Commercial Services, the Office of the Provost Marshal of the Military Police has the access to it, tribunals of inquiry have access to it, the Office of Official Assignees in Bankruptcy and the Court Services all have access to the driving licence registry, and the HSE and the National Transplant Authority don't have access. So we asked the Minister to come in again, and he hasn't shown up today, but he did give us a reply on the 22nd of March and has said that actually it's not data protection. The issue is that the Department of Health has not requested for information from the National Transplant Unit to have access to the driving licence registry. A year ago, the Minister for Transport said, I will ask the HSE to give me their views and see if progress can be made in a constructive way. My question is today, has the Minister for Transport engaged with the HSE on this issue? And when will the Minister for Transport be asked to sign the statutory instrument that will allow the HSE access to the driving licence registry so that people will know if their loved one want to be an organ donor? Bear in mind, and figures supplied by the Irish Kidney Association to me show that when asked by a professional in terms of organ coordination and organ transplant if they would consider donating their loved one's organs, the figure internationally is about 52%. When supplied with information that their loved one wanted to be an organ donor, it increases the organ donor rate by families to 92%. 92% of people, when informed. The only place we currently have a registry is in the driving licence system. And I have outlined all the other organisations that have access to this registry. And what the Minister for Transport is saying quite clearly, he's blaming the Minister for Health and the Department of Health and saying they simply haven't asked for the information. I'm asking today, is the Department of Health going to ask for the information from the Minister for Transport so that this information is available to the healthcare professionals and is available to the organ donor coordinators, the doctors and the nurses and the families of their loved ones so that they can make an informed decision when they're considering donating organs? Thank you. Laska Hirlik.
Sir.
I would like to thank Senator Daly for raising the issue and giving me the opportunity to speak.
On it in the Seanad, on behalf of my colleague Minister Harris, Minister for Health. It is appropriate that we are debating this issue during Organ Donor Awareness Week. Organ donation is among the most selfless acts we can bestow upon one another. The improvement in the quality of life for organ recipients and their families cannot be overstated. We have a duty to do everything we can to ensure that as many people as possible benefit from organ donation. Work is continuing to finalise the general scheme of a human tissue bill and to deliver on the commitment in the programme for government to provide for a soft, opt-out system for consent for organ donation and an associated register. The aim is to make organ donation the norm in Ireland in situations where the opportunity arises. Under the soft opt-out system, consent will be deemed unless the person has, while alive, registered their wish not to become an organ donor after death. However, it is proposed that even though consent is deemed, the next of kin will always be consulted prior to removing any organ. If the next of kin objects to the organ donation, the donation will not proceed. The best way to ensure that your wish to become an organ donor is realised is to have a conversation with your family and to make your wishes clearly known to them. The proposed opt-out register for organ donation will create a clear and easily communicable choice to the individuals to either opt out of deceased organ donation entirely or to allow deemed consent to apply. Signing up to the opt-out register will be a definitive expression of the person's wish not to become an organ donor after death. The Senator's proposal to share Code 115 on a driver's licence in relation to organ donation within the HSE's Organ Donation and Transplant Ireland would not guarantee that the person's wish to become an organ donor would be carried out. This is also the situation in regard to organ donor cards. The decision to donate organs in the case of a deceased person rests with the next of kin. Health service personnel will not proceed to transplant organs without the permission of family members, irrespective of whether the deceased person carried an organ donor card or had ticked Code 115 on their driving licence. Furthermore, due to the need for medical practitioners to be informed about the medical history of the potential donor, to ensure the safety of the recipient, the cooperation of the family will always be required as part of a safe organ donation process. An opt-out register will make organ donation the clear default option and signal to citizens the move towards organ donation being the norm. The general scheme of a human tissue bill is being finalised at present and will be submitted to government shortly.
Don't take this personally. That is not the worst answer I've ever heard to a question inside in the Seanad, but it's pretty close. 1 million people in this country have registered that they would like to be organ donors. 1 million people. That information is available inside in the government system. And it will increase organ donor rates from 52% to 92% if the family are informed that their loved one wants to be an organ donor. And yet you're saying you won't do it. You won't make that information available to families. You won't make it available to the health services. You won't make it available to doctors and nurses so that families can be assisted in making one of the most traumatic decisions that anyone can ever make. You're not going to make that information available. When a person goes in and signs up for a driving licence and indicates they want to be an organ donor, they want to share that information. And the Minister for Transport is saying it's available now to the HSE if they ask. And what the HSE and the Department of Health and the Minister for Health and you, Minister, are saying is you don't want that information available to the doctors, the nurses and the families. That's what you're saying. As I said, it's not the worst reply I've ever heard in this House, but it's pretty close. People are dying waiting for organ transplants. Dying. It's costing the state hundreds of millions of euros. Dialysis and people waiting on the system, taking up beds. But that's not the reason we should be doing it. The reason we should be doing it, it would save lives. Minister, if it saved one life, wouldn't it be worth doing? Making that information available. One life, just one. And yet, the Department of Health are saying they don't want it. As I said, Minister, not the worst reply, but pretty close.
Thank you, Senator. Minister.
Senator, I have absolutely no interest in engaging with you on the politics that you want to engage in this, and certainly I want to distance myself from your interpretation of what I said to suggest that either I or Minister Harris or the Department do not want this to proceed. And you know it's only playing politics with it. And if you want to do that, that's fine.
Okay,
but,
let me be clear. I'm not playing politics. This is not party politics. This is not political.
You
this
had
is
your
an
opportunity for a supplementary,
of people who are waiting for organ
Senator,
donors.
you're being
And to
disorderly
accuse
now.
me of that, I'm just saying, Minister, you're just
Senator,
reading out a reply that was given by the Department
You're
of
not to
Health.
find another way
I'm just saying
of pursuing this further.
It's a terrible reply.
Senator, sorry, you are out of order.
For somebody who is waiting on the organ transplant list,
please resume
is that going to help them?
Don't abuse this House now, Senator. Resume
I'm not abusing the House.
No, well,
but that reply
resume your
is one of the
seat
worst I've
and
ever
obey
heard.
the Chair. That's your opinion. You're entitled to it.
Thank you.
Sorry, Minister, without interruption.
The Government is totally committed to increasing organ donation and transplantation rates to the benefit of patients and their families. And we welcome the Senator's support for our efforts to increase the rate of deceased organ donation. However, deceased organ donation cannot proceed without the support of the next of kin, as I have already outlined in my previous contribution, even in circumstances where the deceased person had an organ donor card or had indicated their wish to be an organ donor on their driving licence. Minister Harris's proposals to introduce a soft opt-out system of consent for deceased organ donation are one of a number of measures being taken to increase transplant rates. The Department continues to work with the HSE's Organ Donation Transplant Ireland, intensive care units and the transplant hotels, which is Beaumont, Mater and Vincent's, in building upon the achievements of recent years. Improvements to our organ procurement service will continue to be achieved through improved infrastructure in ICUs, a more robust organ retrieval service, and through transplant centres achieving high conversion rates from opportunities that are presented. The legislation will be accompanied by a publicity campaign which will aim to ensure that individuals understand the opt-out system and to encourage individuals to have the conversation and make their wishes in relation to organ donation known to their next of kin and other family members. Finally, I would encourage everyone to consider becoming an organ donor and to make their loved ones aware of their intention in this regard.